Hello, back again, Dr. Coring coming at you guys with another episode of Real Health Talk with Dr. Coring. For those who do not know me, again, my name is Dr. Coring. I am an internist by training and trade, as well as a pharmacist by training and trade, and currently in a fellowship learning how to become a hematologist oncologist. And it is my absolute passion and pleasure to educate patients and common folks such as yourself regarding health topics that are geared towards your well being, helping you guys be better at what you do best, which is being yourself. And in order to be your best self, you have to feel your best and operate on all cylinders. And so, therefore, I created this platform to help you guys do that by educating you guys on various things to keep you healthy. And today we're going to talk about salt. Yes, salt, dietary salt, and the consequences of having too much salt or sodium in your body, and how you can prevent and reduce salt intake and also reduce the consequences of having too much sodium in your body. And the main consequence that I want to focus on today is edema or leg swelling. And one of the primary reasons why people hold fluid in their legs or have leg swelling is salt. Too much salt in the diet. All right, so that's my focus. That's my topic today is how can reducing your sodium intake can reduce leg edema. All right, so let's get into it. So let's start the discussion by discussing salt. Where is sodium found? Basically, sodium, dietary sodium we're talking about, as I just said, is found in foods. And so I'm going to spend a lot of time talking about the foods, the various foods that we typically find these high sodium or the high sodium foods essentially. And the main food that, salt is really found in the most, especially the foods that we eat the most that contains a lot of salt, is the processed foods. Um, you see, processed foods, the reason why they have a lot of salt or have a high sodium content is to preserve them. Processed foods are meant to be preserved. Why? Is economic reasons. Preserved foods or foods that last long make more money because they have a longer shelf life. So there's more opportunity for that product to, make money because it lasts longer. And also it helps with shipping, distribution, supply chain as well. So there's economic benefits for processed foods. Hence, they are cheaper because of that, because they last long. And so it's therefore said that perishable foods or foods that are not processed are more expensive because the economic opportunity that are lost when the food goes bad. And so processed food is the enemy here. Processed food is basically 80% of our daily sodium intake, just one processed food product typically. And so a lot of people don't understand what it means when someone says processed food. And so I want to spend time talking about what exactly are processed foods. Canned foods are the culprit. Again, canned foods are designed essentially to have a long shelf life. And in order to do that, salt really preserves products. It's meant to preserve the product. And so it's easy for someone to think that canned vegetables and canned fruits are good. And they are for the most part, but there are some canned foods, even canned fruits and vegetables, that contain salt, high sodium contents. And so it is always recommended that get the canned fruits and canned vegetables that says low salt or low sodium. What else that are considered processed foods? We talked about canned foods, canned fruits, canned vegetables. Don't forget canned meats. All right, canned soups. These oftentimes contain a lot of salt. So if you're going for the canned meats or the canned soups, be sure to choose the salt-free soups or the low sodium soups. All right. Pickle foods. Pickled pig feet is a no-no. Please. I mean, I grew up on pickled pig feet. I used to go to the candy lady. I used to get it. But oh my God, look at the salt content. It's enormous. An enormous amount of sodium in these pickled foods. Pickles itself, high salt content. Sauerkraut as well. So these pickled items have a lot of salt in their process. Snack foods contains plenty salts, chips, pretzels, popcorn. All of these are processed foods. All right, a lot of salts. Um, Lunch meat, bologna, ham. These deli meats contain a lot of salt and they're processed. Okay, so these cured meats, deli meats, you know, bacon, ham, sausage, hot dogs, all of these foods are processed. Okay, so we have to stay away from these foods. All right, and then cheese. Cheese, I know we like our cheese pizza, sliced cheese. These products are highly processed and contain a lot of salts. Okay, so it's important to stay away from these products. And so, Dr. Coring, what can we eat? I'm glad you asked. Obviously, foods that are not processed. So, fresh fruits, fresh vegetables, fresh or frozen beef, meat, fish. If you're going to get canned meats, low sodium canned tuna, salmon is also good. Eggs and egg substitutes. So fresh products, not processed, not nothing canned. That's a good start. Um, I would say also, if you're going to, use fats and oils, uh, make sure that we're using vegetable fat and oils instead of using animal fat. For our oils. I know my mom used to cook with fat back. Salted butter was also used as well when me growing up. So staying away from those things is a good option. Okay, so plant oils like corn oil, olive oil, peanut oil, unsalted butter is important. And if you have a sweet tooth like myself, choosing things like sherbet, pudding, um, gelatin is also a good idea. And then also, staying away from sodas. Sodas have a lot of salt. And so choosing beverages that are low salt is also a good idea as well. Okay? And so we talked about processed foods and what exactly are the processed foods and the alternatives that we can use instead of these processed foods to reduce our salt and our sodium. And in doing so, will reduce the leg edema, the leg swelling. And that's going to bring me to my next and final topic is why? Why are we focused on low sodium? And how much sodium is too much sodium? All right. So the reason why it's important to stay away from high sodium or go above, why it's important not to go above the recommended sodium intake is because we know as physicians, we know that when you reduce your sodium intake, you reduce your blood pressure, It can also reduce kidney disease. It can reduce heart failure, and it also can reduce leg swelling and abdomen swelling. All right. And so, first, let's talk about what's the recommended salt intake. It's recommended that we consume less than less than 2.3 grams of sodium per day. All right. That's the recommendation. 2.3 grams of sodium per day and less. So that's difficult, to be honest. Um, Even with people like with heart failure, for example, and resistant high blood pressure, we advise these people to consume 1.5 to 1.8 grams of sodium per day. All right. And so that could be challenging. And so, the table salts is a no-no. And so we advise people to do away with the table salts, taste the food before we dump salt on it, and also season our food, with alternatives like herbs and spices instead of using the salt. And when we actually when we lower our salt intake and we go with the recommendations, we see the blood pressure drop by 2 to 3 points. And sometimes I've seen patients' blood pressure drop by 10 points. That's the most I've seen. And so that's why. And so, why does salt increase the blood pressure? I'm glad you asked. So, have you noticed? Maybe you haven't, but drinking something too salty, the rationale is to just add more water to it. Eating something too sweet, or drinking something too sweet, I should say, the rationale is to add more water to it, especially if it's something like Kool-Aid. Well, that's what happens in our body. When we consume so much salt, our blood gets concentrated with that salt, and the blood wants to dilute it. And so the rationale is to draw in fluid from our body to dilute the blood vessel in order to dilute the salt. And once we draw in that fluid from our body, it increases the blood pressure. That's what happens. It's like adding fluid to a hose. It's going to increase the pressure in that container, in that hose. And increasing the blood pressure, it puts pressure on the kidneys, it puts pressure on the heart. And once we put pressure on the kidneys, then the kidneys is not operating on all cylinders. And therefore, it's not filtering our fluid, and fluid gets backed up. Once we put pressure on the heart is not operating at all cylinders. And once we put pressure on the heart, and the heart is not operating on all cylinders, fluid gets backed up. And where does that fluid get backed up to? The lungs, the abdomen, and the legs. And that's what causes the swelling. It's the fluid that's getting backed up because the kidney's under a lot of pressure. The heart is under a lot of pressure, all because of the salt. So let's reduce the salt. Let's reduce the pressure. And let's reduce the high blood pressure as well. All right. And let's reduce the swelling in the legs. All right. So we could get back into them skinny jeans. All right. So that's my time, guys. I love you guys. This is what I like to do. Educate you guys. Reduce the swelling in the legs. Reduce the salt intake. Reduce the blood pressure. All right. Stay away from them processed foods. That's my time. Peace and love.